I'd like to welcome Dr. Mariella Catalano, who is the Director of Research Center and Vascular Disease and Professor of Angiology at the University of Milan. She is President of the VAS European Independent Foundation in Angiology and Vascular Medicine and the President of AMAVAS, the Association Against Vascular Diseases. She's internationally recognized with being the honorary president of the UEMS Division of Angiology and Vascular Medicine and the member of the European Board of European Exam in Angiology. Her research focus has been, of course, in angiology, but she's really recognized as a worldwide leading expert in vascular disease. She's had over 180 peer-reviewed articles, and thank you very much for agreeing to this podcast.
Thank you for inviting me. That is
So
a great occasion.
we're just going to be briefly talking about your recent unveiling of the Vascular European Book on Angiology and Vascular Medicine, an international expert guide. What made you decide to publish this book?
When we decide to be mad, because it's a big job, but it's we are very satisfied. We started 5 years ago with the first edition. It was published by a small publisher, but it was the first time that vascular medicine at European level was put together. And it was a great help for the exams, for students, for trainees. And after that, we decided to have a second edition and to renovate every 5 years our book. So now is a second edition. The publisher is Springer, so we made a big step on. We have to say that the enthusiasm of authors has been great and allowed us to arrive to the end of the project. Is a book finalized to connect people, connect energies, connect expertise, and is suitable for specialists who wants to have a quick look on some specific area, as well as trainees and early career people who are interested in vascular medicine, which is so important and so not enough, we can say, considered around. So that is one of the contribution to education VAS is giving to the health population. And what I can say of the book is we try to cover all the parts of vascular medicine. And we had a great contribution also from the lymphatic side that were very cooperative. And so we cover the general part, then the peripheral arterial disease, the cerebral one, the venous, the microcirculation, and the lymphatics, and so on. And we are proud also to cover a small area on ethics, which are for us extremely relevant in everything we do and in every education project. We had more than 200 authors. They are from Europe, mostly from Europe, but we open also from outside Europe. So we have from USA at first, and then Australia, Syria, also a country where now there is a war, unfortunately. And so it's a very European international effort. And that is the way we are going on.
So I really have to emphasize how comprehensive you've made the chapters. They cover A to Z. there's very little that you have not looked into. How did you get such an international cohort together to have such a global effort? Because that's not so easy to put together, such a global effort, but also to bring all those viewpoints, um, especially from countries that may have lower resources. And the practice of medicine in terms of diagnosis and treatment can be quite different in different countries depending on what's available.
Yeah, sure. I think it doesn't happen in suddenly. It's a longer way work. So once has created several collaboration networks, and as as I said before, we try to link people, expertise, quality, and so during all these years we had several contacts and collaboration with centers, quality centers around the world. And so that is the main, we can say, the trust in VAS has been the main facility we had and for collaboration. And I have to say that about the view, you say, yes, we try to connect different countries, but in some country that you mentioned exist, they are part of an international working group or international network. So they express, try to express with the view of the network. And obviously, I think no one book is perfect. So, and that is what stimulates to renovate every time. But I think is a very good basis to start. And the success we have in download and in interest is very high. So I'm very happy for that. We are very happy for that. And one point I would like to stimulate is that this can be a basis to improve collaboration. So people who read the book are very welcome to send us impression, criticism, suggestion, because that is the way to always implement together with a stronger group of editors, but to implement the book in the different years and edition. We think that we were involving all the European country, most of the European country, very few were not represented, but they will be the next time or have been in the previous one. So it's a process where we try to do the best for common aims.
I want to go a little bit more into your vision for the next edition in 5 years. You've set a very high bar for the books going forward in this field in vascular medicine and surgery and angiology in general. How what are you planning to do for the next edition? How do you step up? Where do you end up going? Because the field is constantly changing. There's new data coming out constantly in vascular medicine. How do you keep up with this? How do you make the next version even better?
I think one point is to see reactions and suggestion. The second point is start very early, not immediately, please, because we want to close this audition, but very early to think about the next one. And what we want to defend in our book is the combination between the basic science, obviously, but clinical view, which is so important. And the risk is to forget clinics and to go to instrumental and more upgrade, we can say, techniques, but we would like to have people able to have a clinics as first approach to patient because it costs less, is more important. It gives us the possibility to use instrument and to decide which is the best therapy for patients. Obviously, together with that, we want to implement also the new techniques that year by year or day by day come up to our reality. But having the clinical view and the patient view as the first one, because that is the role of a medical side. We are not surgeons, we are medical specialist, internist, and specialist in vascular medicine. So that is the main aim, and we want also to always maintain the ethics part as an important one, because common ethics means not just a declaration, but means independence from of education and research, from economic interest. So it arrives to patient. It means also the way you have a contact with patient, you communicate with patient, you work for patient, and it means also the view you have of your job, so related to the society problems and the society needs. So I think that ethics are an important part also of our education effort and book. You know, VAS is very proud for this new step, but that is not the only one, because we have an European, which is international, to master, to train people, is 1+1 year. And we have the VAS International Academy, who links teachers and who links centers of excellence for training. And so we launched recently, and we ask you also collaboration, if it's possible. An international atlas for clinical cases, vascular clinical cases. They are on the VAS website, and has been launched by VAS, but with a collaboration. So we work together also with the American Society for Vascular Medicine, with the European Stroke Organization, with the European and the International Lymphology Society, and with VASA, which is the organization who works on vascular anomalies. So is an effort, once again, linking energies. Is very positive to cooperate with quality and the loyalty. So when people try to do the best, not to defend one organization, but to have a good common results. And that is our aim, our approach to you. And so that is our general effort.
Thank you so much for agreeing to do this podcast and all the exciting work that you have been doing and continue to do. It was really a pleasure talking to you about all of these different initiatives, and congratulations on this new textbook.
Thank you very much. We hope to make some steps on in the next future. And what I can say that we are all working for our patient and for our societies. Thank you very much for your kind invitation once again for the future.
Thank you.